Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Columbus, Georgia, and it is time for the TT Time with Dr. Tarver is a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. We made it to the end of September, everyone. I know it has been a month with a lot going on, and we've also covered a lot this month. We started this journey in talking about our own self awareness and the things we wanted to commit to in our development and our change and growth process. We discussed suicide awareness and prevention, and just kind of normalizing for people that at some point in our lives we could get to a point of experiencing significant loss or despair and wanting to make sure we have the resources to be able to have hope and know where we can get support and connection from. Last week, we discussed recovery and the things that are going to allow us to be able to maintain that journey of sobriety, but also if it is not alcohol and other drugs, for example, that you are trying to make some changes with, that whatever it is in that journey, that you are recognizing the things that could interfere with you being successful and making sure that you have the type of support and resources in place to continue on that journey to recovery. And then this week, in honor of Alopecia Awareness Month, we are going to be addressing alopecia. I know I have not covered that topic before, though I probably referenced it a few times. But I think that for a lot of people, maybe alopecia isn't as well known. However, in 2022, the slap heard round the world, if you will, when Will Smith slapped Chris Rock at the 94th Academy Awards. I think some people begin to talk a little bit more about alopecia because allegedly the slap was triggered by a comment that Chris Rock made regarding Jada Pinkett Smith's hair. We learned, if we didn't know prior to then, that Jada had alopecia. Now, since that time, we recognized there was some other things going on, but that's neither here nor there. But I do want to today talk about how alopecia um, can just affect our wellness and that it can have an impact on our self-worth and our self-esteem. And so let's get into it. What happened to your hair and other insensitive things that people say as we are discussing alopecia awareness. So, for those of you that did not know, Alopecia Awareness Day is this upcoming Saturday, September 28th. And I think that people may not necessarily know that there are a lot of different types of alopecia. Alopecia areata is a common autoimmune skin disease, and I think that is the one that people most equate to having alopecia. Alopecia just means bald, and areata means patchy. And what ends up happening with this particular form of alopecia is that you can get hair loss on your scalp, on your face, and sometimes other body areas, under your arms, on your legs. People with alopecia areata most often lose hair in like those circular coin size patches, and you'll see that a good bit in children. In the most severe of those cases, you can also see individuals lose all of their hair all over their body. So it could be scalp, eyebrows, eyelashes. And I think most oftentimes we equate that to what happens with individuals when they're undergoing cancer treatment. However, that is a different type of alopecia. We'll get into that in a second. So, how common is this? Estimates say about 7 million people in the United States and 160 million people worldwide. So, if you haven't had it, you have an opportunity to have it at some point in the future, or you may know a family member that will have it. Uh, More often than not, so probably about 80% of people will notice signs of alopecia areata before 40. Um, about 40%, so almost half, will experience symptoms by 20, by age 20, yes. So we are seeing a lot of younger people having alopecia, even though you may not necessarily recognize that because we are able to do different things hair wise to be able to navigate it. However, women have higher risk factors, and also people of African American, Latinx, or Asian descent have a higher chance of developing alopecia areata. So it is what we call a polygenic disease, which just means that there's multiple genetic risk factors. Not everyone that has the genes will necessarily develop it, but of course, with any other risk factors, right? If you have a close biological family member with it, then your chances increase. And they increase even more if that close biological relative lost their hair before the age of 30. And again, there can be the circular kind of coin size oval patch hair loss. That's the patchy type. There can be that complete hair loss of the scalp. So no hair on the scalp, that's total. And then universal, which means the loss of the hair on the entire body, which means including your eyebrows and your eyelashes. There are other types of alopecia as well. And I think this is where, for most people, you'll end up saying, like, oh, yeah, okay, I'm noticing more signs of this. So, one of the most common types is what we refer to as male pattern and female pattern baldness. For men, that's the receding hairline. For women, it is typically the hair starts thinning at the top, where we say along the part. And so you'll see kind of that thinning across the top of the hair. That's androgenetic alopecia. The hair usually thins at the top and it thins on the sides. And so you'll see men kind of their hairline will start going back a little further, or you'll start seeing that baldness start in the top, and then it'll kind of seem like it's spreading out. Um, as men get older, you'll see a lot of that hair is gone at the top and around the sides, and there may be that hair in the back. That's how my father balded. The hair was back in the back. He kept the curl back there for a good while before I was like, Father, it is time. But we'll talk about why that can be difficult when we are losing our hair. For females, that thinning is often what we'll see first. And then what you'll do is you'll start seeing females kind of change up their hairstyles, men will too. You've seen the comb over, but you'll see people kind of changing where that party is, and also kind of taking some of the different medications as options to be able to address it. We have diffuse alopecia, in which the hair will thin and fall out, and it's kind of more scattered across the scalp. And that can be caused by significant stress, the side effects of medication, or sudden hormonal changes, which is why a lot of women will notice differences in their hair texture and pattern as they're aging. And then we can see hair loss caused by medication. And what it happens is that medication affects how our hair follicles grow. And so healthy hair follicles are damaged essentially. And that can occur with things such as chemotherapy, for example. We have the traction alopecia, which we've learned a lot about over the years now. And so when we were pulling our hair up in those ponytails and we were getting those braids, so when hair is repeatedly pulled or tightened in the same direction, you start seeing hair loss. And so this is when you'll start seeing the hair loss across the edges for a lot of women. We recognize that putting the wigs on and gluing them down, right? So that's pulling that hair out. And once your hair is pulled out from the follicle, it's not growing back. And so, unfortunately, what ends up happening is, and you'll see this with people that have locks as well. That's how my locks broke off. By, pulling them back tight and not having them in little buns and ponytails, and not recognizing what that was doing to my hair. And I think for a lot of us too, when we start doing things to try to change like the composition of our hair. So maybe we're using perms or wave kits or different chemicals. Then you also can affect the texture of your hair and affect your hair follicles by using things that chemically are causing some changes. They cause your hair to thin. They can cause your hair texture to change. So the blowouts, the pressing. People used to get their hair pressed out in a certain way, and it would absolutely change their coils of their hair. And so now it doesn't have the coil anymore. So, because of the type of heat that was used and the damage to the hair dye, all of these things that we're realizing now can affect us. And so, as we know, if you've experienced anything with regard to changes in your hair, particularly over I would say 30s and 40s, you start kind of recognizing those things. Then you have probably tried to figure out what your options are. Okay, so what can I do to make some changes? Is it possible for me to be able to stop the effects of this? Am I going to be able to slow it down? Can I get my hair back? Like, what are my options? And, truth be told, the answer is it depends. And so sometimes there are things that you can do in order for you to be able to see some of that hair come back. For example, if you were taking some medications and you now are no longer taking those medications, you may be able to see some growth come back in your hair, right? Um, there may be some options for you to be able to use some topicals on your hair. I know a lot of people have tried Rogaine, for example. I know that we know, for example, that there are certain foods that we can eat that will promote healthy hair growth. We know that peppermint is something that is able to be able to see some benefits. We know that there are vitamins. There are a lot of people that utilize coconut oil. There are a lot of people that are getting scalp massages. There are people that are reducing their stress, right, to be able to promote hair growth. We know that not pulling that hair, so utilizing hair techniques that aren't pulling your hair tight. You'll have people take breaks from getting braids, for example. You'll have people take breaks from pulling their locks up in really tight styles. Reducing inflammation. So you may be able to take some medications that reduce the inflammation that may be interfering with your follicles. You may be able to take some medications that can help with your hormonal fluctuations. You may be able to change how you're eating. Iron, right? Low iron, we recognize, is one of the things that can interfere with your hair growing. People will take biotin, that's a very popular one, vitamin E, zinc. Those are the things that can help support those healthy hair follicles. We also know that making sure that you're getting good hair care, right? Like sometimes we're doing it ourselves. I know a lot of us have done a do it yourself perm or do it yourself hair color or do it yourself haircut. And so sometimes we're ending up causing some disruption. And so, as we are going to a hairstylist that is able to take better care of our hair, we're having regular appointments. So you're putting that money aside. Maybe you're not going out to eat as much to be able to address making sure that your hair is healthy. Being very mindful. I know a lot of people, for protection, will sleep in a do rag, a headscarf, a bonnet, and so making sure that whatever you're sleeping in is not actually um, interfering with your hair follicles being able to breathe. That's not putting additional pressure and stress on that hairline. We know that also with regard to stress, because cortisol is what we've talked a good bit about cortisol and chronic stress and how that can disrupt hair growth as well. And so making sure that you're exercising, you've got relaxation and mindfulness, right? Good sleep, all of those, water, all of the things that we talk about just in general that promote wellness. But then also, I think that you may get to a point where you may need to go and see a dermatologist to be able to talk about if there may be some other things that you can do. Um, Sometimes our scalps aren't healthy. We might have psoriasis, dermatitis, dandruff that could be interfering. And so we want to make sure that we are seeing a dermatologist, that we're addressing any infections, any inflammations that could be negatively impacting our hair. There are some different types of therapy out there. So platelet rich plasma, which we know can promote healthy hair growth in some individuals, improve blood flow to the scalp, allow the hair to be thicker. We do know that there are some injections um, that people can get along the hairline that could potentially promote those follicles being healthy and growing. Um, Now we do recognize, unfortunately, right? Like there are certain things you do have to change up. So you might be unable to use the flat irons in the same way or the dryers in the same way. Not brushing your hair when you have it's tangled. You might have to change up how you are doing whatever treatments you're utilizing your hair. Take longer breaks with them. Make sure you're using a good conditioner. Um, Make sure that you are completely understanding your hair type and how your hair best functions and what kind of products are best for your hair. Again, going back to the making sure that you have a good hairstylist. But again, there may also be I did a lot of different treatments to try to address my alopecia. I got injections. I did topicals. I did oral medications. So there are a lot of different options. But then you may get to a point where you recognize that even in doing all of these things, working with a provider to address it, that you may not be able to get the hair to come back. And I think that is when we have to address the impact of hair loss on our mental wellness. So, what does it do? It can cause you to have low self-esteem, right? Like our hair, we talk about a lot of times, particularly for women, hair is considered a crown. And for a lot of women growing up, then what is valued is when your hair is fuller and thicker, often longer. And so, as your hair is thinning, as it's shorter, as it's shedding, as you have to do different hairstyles, you may not be able to dye your hair as much, or you may have to move away from perms, or may not be able to straighten it as much. You may have to wear it more in its natural state, which may, allow you to feel a little bit insecure about how your hair looks because you aren't able to do all of the different, maybe more ornament hairstyles that you may have been able to do and have as much versatility with hair as you used to, and so that can be really difficult. Also, I think financially it can be challenging for people to try to really have the good health care that they need with regard to their hair maintenance. And so investing that money can be tough at particular times. Like sometimes we have to feel like we have to choose. And so being able to find some good websites and have some good information, YouTube, to really be able to learn some ways to be able to manage your hair in between those appointments. You may also have to make some sacrifices so that you are saving up some money, maybe not going out as much to eat, or maybe cutting back in some other areas in the budget to be able to get some of those appointments, even if you can only do it like, hey, once every month or every couple of months. And then, I talk to my hairstylist about how to maintain in between and products and try to be sparing with them so they can last, and making sure that I'm getting the most cost effective products I can, but also the ones that are going to be really good for maintaining what I do have, right? So we get into the point of just kind of preserving what we have. Sometimes it may require that we cut our hair, we have to start over. Um, I know for me, I started over. I cut my locks and then I started them over. I had to cut them again because they were still thinning, right? Because it just depends on what is causing your alopecia and if it is something that is able to be managed and treated, or if it's just something you have to again accept. Now, women, we have a little bit more options with regard to some things that we can do. We can wear the wigs, we can do protective hairstyles. I am seeing a lot more men moving toward that, of being able to get. Now, you can do the hair transplants. For some people, that has been successful, but again, you want to make sure that you're going to a qualified person, and also that you recognize that anything has its potential to work and its potential not to. And so, being able to understand what those percentages are in terms of how effective this is and what's the likelihood of being able to regrow hair versus if you're just trying to have a cosmetic look, it's not going to necessarily grow any hair. It will just allow you to be able to have hair in places. We toupees. I know Steve Harvey. Y'all didn't recognize that high top was actually a wig for a lot of years, and so men installs have come a long way, and you definitely see men being able to do those things as well. But I think there's a lot of more stigma toward men doing installs and being able to address other ways of trying to have the appearance of having hair, adding, if you will, like women, we have done weaves and extensions and hair pieces for a long time, and it's a bit more normalized for us. But for men, again, other men might be trying to shame you. I see a lot of shaming going on, unfortunately, on social media. Like, what's going to happen when you go to bed? You're going to wake up and your hair is going to be off, right? And so, being able to really have a conversation with a partner about you having alopecia, and right, like we don't want to surprise people, so because at some point the wig got to come off at some point, particularly since we recognize that as we're moving toward trying to preserve that, or for some people that aren't in a position where they even have hair to be able to glue down to or to be able to sew into, like sometimes you're gonna have to remove it and sometimes it's healthier for you. And so being able to have conversations with people, and being able to be comfortable in your skin and recognize that you're not your hair, right? Because it can give us a lot of anxiety. Are people going to accept us? Are people going to think that we're attractive when we remove all of the things that we may be utilizing during the day? So being able to one, love yourself, I think that's really important to address the hair anxiety, and two, that it's important for you to recognize, and a piece I didn't cover, trichotillomania, where people are pulling out their hair, and right, again, you move your hair from the follicle, then it doesn't grow back. And so some people are able to rock that baldy, right, and they are able to embrace it and lean into it, and then other people, it makes them very self-conscious. And so I want you to hear that you have options in terms of what's going to make you feel comfortable, and that choice is different for everyone. Some people are able to rock that baldy, even for men, shaving your hair off and becoming bald. But for some men, it doesn't feel comfortable for them. They may not like necessarily the way their heads are shaped. They may not think that being a baldy is going to be an attractive look for them. And so they're thinking about other options. Some people just aren't ready to quite embrace it yet and shave it off. And so whatever is there, that's what it is. And that's okay as well. But I think whatever that is for you is owning it, and being able to celebrate yourself and not have that self-consciousness, because that's what affects our self-worth and our self-esteem. So like now, I'm trying to make sure that nobody is standing behind me so they can't see my bald spot. Or I'm trying to make sure that, like, when I have to take a picture, I tell people, like, take it from the side because they don't, won't see the edges that are coming out. But I will say to all of you who are considering how you want to manage your alopecia, is to make sure that you're not doing things that are actually causing more harm. So what I've seen is women still getting braids and still getting weave, and it is, what it's doing is causing more tension alopecia, and it's just going to go all the way down, right? And so like the edges are already gone, but I'm continuing to do the same hairstyles that took my hair out in the first place. And this is why it's very important for you to have a hairstylist who cares about your healthy hair and not tell you what you want to hear, who may say to you that's not actually healthy for you to do. Like, we don't need to keep gluing those wigs down. That's what took out the hair that has been taken out, right? Like, say, like, let's talk about some other options for you. And the same is true for you men. Like, I know men can get away with a comb over a little bit for a while, Some of you may have locks. You can kind of like put them up so you can't see the bald spot in the middle, but you do have to be aware that over time that hair is going to still pull and it's going to take out those other locks. And so being able to really think about like, okay, what's my longer term plan? You know, in the short term, I might be able to ride this out for a few more years or so. But what's my longer term plan? And being able to take that time and really process. Because I think a lot of times men in particular aren't given the space to be able to process the changes that occur with hair loss and our identity and our worth and our value, because we do, we tie a lot into our hair. And so making sure that we are fully addressing that. Here's your plug for therapy. You may want to talk to someone about that. It may be that, and sometimes men, you all can, be a little hard on each other. You joke and you play, but you do need to be able to have a space where you're talking to that barber that you trust, who is telling you like, hey man, like we got some options. I know that you don't think you would be able to rock this and it'll be uncomfortable because so you're so used to your hair looking a certain way, but let's talk about some things that might actually work for you. And that includes an install. That might include you shaving your hair off. It may include you starting over and getting a lower haircut when you're used to having longer hair. So there may be some things to consider. But I do think it's important for you to take that first step of having an open and honest conversation about it with somebody that you trust. And the same is true for us ladies. And that may include a barber or hairstylist. It can include a dermatologist. It can include a mental health provider. So you have some options with regard to that. So what I want to tell you all is that, and I didn't address as much children either. It's a very different challenge. Kids can be very mean and cruel. And so helping your child navigate through alopecia, I guess I'll have to kind of do a part two at some point to really talk about how to address that with your child who may be dealing with hair loss from alopecia or trichotillomania. And we see that a lot in our elementary and middle school young people, and being able to navigate that. So yeah, let me not shortchange that. I'll have to do another follow up on that. But in terms of being able to manage all of these things and family members, right? Because we talked about first degree biological relatives, your higher chances. So these are some of those things we need to talk about in the same way we talk about our heart health history and our high cholesterol and our blood pressure and our propensity toward breast cancer or other types of cancer, right? So this should be a part of that discussion with family members so that we can prepare people to be able to navigate like, hey, yeah, when I hit 40, my hair changed and I started noticing some hair loss. Or when I hit 30, some people will start experiencing hair loss earlier in age. And so being able to talk about that hair loss management plan. Yes, I talk about plans a lot, but plans help you be able to be prepared. And so it's going to hit you hard, but it can hit you a little bit with some grace and empathy and understanding if you've already had a chance to kind of talk about it and know what your options are. Okay. All right. You are not your hair. But however you want to wear your hair, I want to make sure that you feel comfortable in it, but that you know that you are loved with locks or without. All right. Be well.